Okay, then the facial nerve. It is pretty easy to understand, but I don't know, for some reason, some strange reason actually, a lot of medical students make a fuss about it. They find it very difficult, very nightmarish. So before we move on to the pathology of the facial nerve, let's just discuss what the facial nerve does. What are its normal physiological functions? Okay, so what everyone, whenever we talk about the facial nerve, the first thing which comes to mind is, okay, the facial nerve controls facial expression. Okay, this is the commonest, basically the by far the most talked about facial feature of the facial nerve. But what else? Okay, do you know it controls something else like taste sensations on the anterior two-thirds of the tongue? Okay, what else? It also causes lacrimation, the lacrimal gland. It has a parasympathetic supply towards the lacrimal glands. Okay, and obviously the salivary glands, except the parotids. So the salivary glands, except parotids glands, except the parotids. So which salivary glands are there? Submandibular and sublingual. Okay, and it also has a motor supply towards a very small muscle. It's called the tensor. Sorry, what I'm talking about. Muscle supplied by the facial nerve is called the stapedius muscle. Okay, what is the function of the stapedius muscle, by the way? Remember, this is okay. This is the ear canal. This is the eardrum. This is the handle of the malleus, incus, stapes, foot plate of the stapes, cochlea. Okay, stapedius muscle attaches over here somewhere like this, and it has the same function as the muscle we talked about earlier, which was over here, tensor tympani. Whenever there's a very high pitched, or sorry, a very high amplitude sound which is coming here, like a very loud sound, and this stapedius muscle actually then contracts and dampens the effect, prevents movement of the foot plates of the stapes, so that no excessive sound is actually transmitted into the cochlea and damage, and preventing damage to the hair cells over there. Okay, so this is the function of the stapedius. So I'll just give you a little moment to copy this down. This is very easy actually, and just memorize this, learn this, and because once we talk about the facial palsies, this will become very easy and we'll apply it very practically over there. Okay, these were the function of facial nerve. Oh, by the way, taste on the anterior two-thirds of the tongue, right? So which nucleus is responsible for detecting these? Remember something called as solitary tract nucleus. Okay, which is in the pons and the medulla. So the solitary tract nucleus inputs from two other nerves, nerve 9 and nerve 10. We'll talk about these later. Okay, these were the basic functions and the physiology of the facial nerve.